So after the disinfection and air dry the instrument, we can now do the wrapping. Wrapping. It is the packaging of instruments and materials that requires a sterilization process by saturated steam or ethylene oxide. It is important to properly wrap surgical instruments so that the autoclave can sterile them for the next patient. Before we get started with doing the wrapping, the tools they need to have been sanitized with the disinfectants and rinse, and then dried off. They must be completely dried before going to the autoclave because we can't get any of the paper wet and we cannot be introducing any excess moisture to the autoclave. Before wrapping, inspect all the instruments for cleanliness and their functions. Prepare equipments for wrapping. This requires 2 pieces of autoclaving paper or a crepe paper, the surgical tools, an indicator tape, a gauze, a cotton, and an indicator strip. For all the tools that have hinges, we need to make sure that they are all open, and the reason why we want to make sure that we put cotton between here is to keep all these hinges open, because if we want the tools to be open so that all the surfaces are going to be exposed to the incredibly hot air that will be created by the autoclave. So we will put a cotton between of the instrument that have a hinges. For the instruments like vaginal speculum, you want to make sure that all the clamps were open. If the instruments are sharp, cover the tips with a tip protector, or you may use a gauze for safety and prevent holes in the paper. Also, put a cotton or gauze when wrapping an instrument with holes like iodine cup or on surgical bows. Let's start by laying down the autoclave paper. The paper is pre-cut into a square. Turn the square paper so it looks like a diamond. This step is important to help make sure the right order of folding takes place. The next step is put all the instruments in the autoclave paper. Before we continue to the wrapping, make sure all the hinges are open and all the sharp areas were covered with gauze. The last item in the kit is an indicator, and it's going to tell us the temperature inside our kit and that we made cut to the proper temperature that we need for these tools to be sterile. So we want to make sure that we put one inside. To begin the folding process, take the corner that is on the bottom and pull over the tools. Don't pull way over the tools or the package will become too loose. On the corner that was just folded, take the point of the corner and fold it down to create a tab. The tab is needed for when opening up the package to keep the items sterile. Remember, the paper is laid out in the shape of diamond. Grab the left corner and fold it across to the right side. The goal is to get the package snug but not too tight, otherwise the steam and pressure can flow through the paper and sterilize the tools. So just like the last fold, make a tab by folding the tip on the corner back. Again, this helps when an opening of the package to keep the tools sterile. Repeat this step but do the opposite for the right side. And don't forget to make a tab. All that is left to fold should be the top corner. By now, the tools are covered up by the other folds. Take the top corner in the fold and fold over the package. Now wrap the top over. This way, wrap around the back side of the package. It should now look like an envelope. Finally, grab the indicator tape and tape down the corner that was just folded. Make sure it taped down securely so it does not become loose while in the autoclave. Roll the tape all over the package. Make a little fold at the end of the longer tape so that it's easy to open. And finally, label the package with the date you will autoclave it. And also, include the items or instruments you will rewrap and your initials. So this is our final package for wrapping. And after the wrapping, you can now do the autoclaving.